A very good morning wherever you are watching. This is a special broadcast brought to you by the Ministry of Health as the government goes on to intervening in what is being described as a resurgence of malaria and the need to ensure that vaccination reaches each and every one that needs to be vaccinated. Aspects including the introduction of new vaccines on routine immunization is pretty much on the prong that is being undertaken, and we have been talking to a series of experts who are sharing information as well as perspective on the matter. I'm Chris Higenyi, and I'm joined on set by Marion Natkunda. She's a senior communications officer at the Ministry of Health. Many thanks for joining us. We also joined on our left by Dr. Catherine Maiteki Sebuguzi, Deputy Program Manager at the National Malaria Elimination Division in the Ministry of Health. Doctor, you're most welcome.
Thank you.
Great. Allow me to begin with a doctor who should be able to give us a preamble on the latest initiatives by the Ministry of Health as it pushes the government's efforts to ensure eradication of malaria, but also the introduction of new vaccines on routine immunization.
Okay. Thank you, Chris. Lovely to be here. I'll just start a little with malaria and what malaria is, so that we can then roll into malaria. So malaria is a parasitic disease. It's caused by a plasmodium, and there are several types of plasmodia. But in Uganda, the predominant one we have is called Plasmodium falciparum. And it is transmitted by a female Anopheles mosquito, the bite of an infected female Anopheles mosquito. So when this mosquito bites a person, it could be a child, an adult, the parasites make their way into the bloodstream. They find their way to the liver where they multiply. They are released yet again into the bloodstream and infect red blood cells. From there, they make hundreds and millions of copies. They can affect organs, and that's where the chaos starts. You get a fever, you feel weak, you get diarrhea, you get vomiting, and in the severe forms, you get issues like kidney failure. We have people getting convulsions. Since it affects the red blood cells, you have anemia. It causes the red blood cells to burst. And then you have a child or an adult with anemia, and they'll require blood. It can also affect the breathing, go to the lungs. Now, those are the severe forms.
That's right.
And the biggest challenge now that we are having is people are a bit, I would say, used. We use the word apathy. They don't really fear malaria, and yet malaria kills. So most of the people will get the mild, the uncomplicated form. They'll feel a bit weak, as I've said, they'll vomit, they'll get diarrhea. But every now and again, we do get severe forms. 5% of the people who get malaria actually progress to severe malaria. And that's where the chaos starts. So what is the government doing? We have prevention, and when we go to school, you remember even in primary school, we had the famous prevention is better than cure. So we do advise the public to use the preventive measures. Insecticide-treated bed nets, we give out nets every 3 years to the entire population, but we also have continuous distribution, where nets continue to go out through antenatal care clinic. If you're expecting, you should receive a net as soon as possible, as early in the pregnancy. And those are available at health facilities, but also the public can procure. We give nets to little babies when they come for the immunization clinics. We give nets in schools. So the important thing is for the public to know that you should sleep under the net to prevent the bite. So beyond the net, we do indoor residual spraying, where we spray households. We put a chemical on the wall. If the mosquito sits on the wall, it dies. The lifespan is reduced, so it's not going to transmit in that community. There are insecticidal paints, those are around. You know, Plascon, I remember there was a big launch. So some people who can afford that, use that. We have repellent plants, advisable to plant them around your house in the communities, the neem, the nitros. There are several, many of the spices. Lemongrass are actually repellent plants. But there's also environmental management. People shouldn't stay in their homes with bushes. We're not meant to stay in the bush. We're not animals. So clear the area around your bush of weeds, stagnant water. You'd be amazed that even polythene bags, if a polythene bag is left to lie, it will collect enough stagnant water for breeding. And then all sorts of puddles around the home. So hygiene helps us in that preventive arm. More for prevention, the pregnant mothers, they take Fansida within pregnancy. That's through the health facilities, the clinics. And now, since you asked what else are we doing, we've launched the malaria vaccine for children. So those are the main initiatives we have in terms of prevention. But the public, just before we cross over, the public should know that one of the most important things is when prevention fails, because at times it fails, it's important to know that every fever, you know, there's a verse in the Bible that says, don't let the sun go down when you're angry. In the same way, you should not let the sun go down with a fever. When you have a fever, take the child, you go to the health facility, we test you, and we start treatment immediately. That helps us not go to the severe arm that I talked about.
That is right. Okay. Thank you very much. Now that, of course, given the fact that government is rolling out, introducing a vaccine, it means the spectre is ugly. The number of people we lose to malaria across the country must be in staggering figures. If you don't mind, take us through the thinking behind the introduction of the malaria vaccine and the rollout, because I'm sure there must have been a war room meeting. You know, like here we are faced with this particular crisis upon us, and we're going to tackle it this way.
So why did we bring in? Why did we bring in the vaccine? I've already mentioned all the different measures we're using, and there are more. Preventive medicines are not only for pregnant women. We have preventive medicines for at-risk populations like travelers, and also children with sickle cell disease, and children living in places, for instance, Karamoja. It's a place where malaria is really seasonal. It's not at an all-time high throughout the year. There are certain years starting in certain months, starting right from May, June, July, August, September, about 5 months where malaria is high. So within those months, we give the children preventive medicine to help them. Now, with all these tools that I've mentioned, the vector control, the medicines, the treatment, we still get malaria. Uganda is number 3 globally in terms of burden of malaria. We have a staggering 12 million cases in this country. Number 3 globally. We come right behind Nigeria and DRC. Now, those are large countries, and DRC is really war-torn. So for us to be in there is not something we should celebrate.
Absolutely not.
It's tough, it's rough. And in terms of death, we come in at number 8 globally. And every year in this country, we lose about 5,000 people to malaria. That's more than a taxi a day. But you know, because of the way it is reported, it's not reported with that scare. It's silent. It's picking one person here, one person there, but it adds up. And it affects us economically. Children also with the parasites in their blood circulating, the academic output. And it's keeping us behind. If you look at the healthcare costs annually, it's a staggering figure. Even at the health facilities, 10 people attending a facility, 4 of them are there for malaria. If you're in the inpatient, 2 of them are there for malaria. At the mortuary, 1 person has died from malaria out of 10. So we needed more tools. We needed more tools in the box. And you know that vaccines are one of the biggest tools in terms of prevention of disease. The most important is water, washing hands, and being clean. But vaccines come in at number 2. So globally, the world has struggled over the last several years, about 30 years, to look for a vaccine. Just as I said, prevention is better than cure. How can you help the body to be strong, to fight the enemy? So it's been a journey of 30 years plus. Lots of money has gone into it, but the country brought it on board to complement the different tools we already have. The nets, the spraying, the medicines, and the beauty with the vaccine is once it's introduced into your body, it goes in and then it starts to do its work.
Yeah.
Some of these other tools, you have to rely on the parent or the person to keep going under the net. But with a vaccine, once we inject the child, or if it's an oral, then the body will work with you and produce the immunity that you need. So that's how we came up with the malaria vaccine, to improve the immunity of these children who are very vulnerable and act as another tool. Okay. Alongside the other tools.
So Marion, the water sanitation and hygiene initiative plays well into this particular effort. And then the immunization drive, one that focuses on routine immunization, focusing on zero-dose children, and of course the introduction of the new vaccines into routine immunization. This is a massive program by the ministry.
Yeah.
Tell us about that.
You see, I think we're taking it on from COVID. Remember when the COVID vaccine came, it came on its own, like we administered it on its own.
That's right.
It wasn't put into the routine, the normal routine, the table that you're seeing of all the immunization, the vaccines that we have.
Yeah.
And we thought the introduction of this vaccine of malaria, if it also takes that turn of COVID, it being on its own, I don't think would have captured the uptake or would have been able to tell the message for the uptake. So what we did is, like, since it's a normal vaccine, like any other, malaria has also been a disease that has always been treated. The Ministry of Health saw it fit to put it in among the routine. And if you notice also on the table that you have there, the age that she mentioned, or the children that are taking it is 6 months, then there's 8 months, then there's 10 months, you see. So we had to make sure we fit it in. But I'll take it on from what my colleague, Dr. Kathy, said, is that I think what we have done as communicators at Ministry of Health is to deal with behavior change. And attitude. And before any rollout of any vaccine, including malaria, one of the things supposed to do is now is address the misconceptions and the myths about malaria. I mean about the vaccines especially, yeah. And again, every time we have any introduction of any vaccine, and I'll again mention COVID, we knew, you saw what COVID vaccine did. It had an issue of this is the Western world vaccine. How come us who are doing the normal thing of taking, what's it called, taking the ginger, the lemon and honey, all those concoctions, we are okay. Now, all of a sudden, we have the vaccine now. People didn't believe that actually COVID was that bad. Now, when the vaccine came, that's when people started saying, I think we need to, the community started believing, and I think this concoction has to go alongside with science. And of course with the vaccine of COVID. So the malaria vaccine, the attitude at which we have kept ignoring malaria and having said that it has been there for years. Who dies for malaria? And even when I tell Kathy, or tell anyone in the community, or tell you, Chris, and say, do you know, I think I have a fever, I have malaria. What will you tell me, Chris? The first thing you tell me, do you have Panadol? Can you take some?
Not Chris.
No, I'm just saying.
I perfectly understand.
I'm just saying that is what would happen in the community. Someone would say, even in the village, I think I had some Panadol somewhere. Let me give you, and the fever comes down. Or those days, okay, which still happens, is that a mother would get a wet cloth and put on the baby and start coming out, which is good, because that is the first aid probably you do. But now, looking at the first of all, and maybe she'll explain at how the mosquito has changed, because we do not have the mosquito that we used to have then. It keeps changing. We have a different types that come in all the time. So when it comes to WASH, of course, it is one of the things as a thematic lead for WASH that I'm really preaching at the ministry in terms of health promotion, is that it starts with me and you, and then also it starts at home. At home, where I stay, the landlord has put a hedge of flowers and all. And I kept telling her that, you know, time has reached when we don't need decorated compounds with beautiful flowers that are going to make us sick. Because if you notice also the trend at which we are getting allergies and all, kids come up with all the pollination and affects children. I said, how about we introduce the repellents? And she was curious. I was like, which ones are those? And I had 2 on my veranda.
Okay.
Like she mentioned some. I had that rosemary. We all know rosemary. And then I did the lemongrass, which we use for tea, to take in tea. I said, now if you go and plant these around, I don't think we shall have mosquitoes. But also, look at how the water that is coming from the other neighborhood is flowing down and does not have exactly where it is going. How about we also treat it? Or you're doing fumigation. So what am I saying is that it is just those small observations that we do in our homes that will help us in terms of prevention. Okay. So my message is WASH is really one that rides on water, sanitation and hygiene, rides on to malaria, because when you don't have stagnant water, you're not going to have breeding space for the mosquitoes. When you plant repellent, the plants, which we are trying to also bring out and make sure that people are aware of these plants, because also there's one thing to have them, and there's another thing people to know about them.
That is right.
Yeah.
Okay.
And then also, of course, in terms of hygiene, you know, 70% of diseases are preventable.
If you are clean.
Exactly, if you are clean.
Wow.
They say our hands have 4 million germs, 4,400,000 a day. So how many times do you wash your hands? I'm about to call you Dr. Chris, because now you're into the into the medical world a lot with us.
Okay. Yeah. Let me stay with you on the rollout, especially when it comes to the WASH initiative.
Yeah.
I know schools are part of the campaign. Many have been onboarded to ensure that learners are practicing it both at school and at home. But if we were to map areas where malaria incidence has gone down or hiked, and we are able to attribute it to a set of factors, would we say places where WASH has not been embraced, the incidence of malaria is still high, and areas where it is actually practiced religiously, so to speak, malaria has dipped as a single factor? Is that something you can put your finger to?
Not that much, because if you look at the setting of our schools, also matters. Every piece of land that we get and we think of a school, we want to put up as a structure. But I think sometimes we also don't look at the end result in terms of protecting the students. I was in Chibuli. There's a school in Chibuli, and you know, not to harm anyone, you know that Muslims wash every time they clean.
That's
every time
right.
they're going to pray. They probably wash their face, they wash their hands, they wash their feet before they walk into the mosque, and then the school also does the same. So we did an observation. This one I did it under Rotary, because I'm in Rotary. So, and I'm like, you guys practice cleanliness, and of course going through God, going to Allah, you have to pray and make clean. But look at the place where you are washing your hands from, or your feet from. There was stagnant water. When you open the tap and it splashes down, what comes back?
What comes back?
The dirt. So have you actually cleaned? So I told the Muslim friends around the school, I said, how about we, the Muslims, take up the initiative of cleaning this place? Because you need water forever. You have to wash, you have to pray.
That is right.
You get. How about you clean the place? And they did not understand. Then I said, do you know, and you know you can tell lava. You can tell lava from stagnant water and see how it's growing with algae and everything. I actually told one of the teachers, I said, do you see what that is? That is actually, those are insects breeding. I don't know whether they are mosquitoes, but they might be larvae for mosquitoes. Now tomorrow, you're having a class of 50, and it has reduced to a class of 10, or 4, 5, 6 kids are sick. And what is it? Malaria. Then you think the person must have gotten it from home. No. They probably got it from school, 1, because of the dirt and the hygiene, and then 2, maybe one of the mosquitoes that always work, because how long do we stay out than we stay in back at home? So they always say that the mosquitoes always, most of us who are always out and go back home probably like around 8, 9. You've already conceived the big good bites of what? Of the mosquitoes. So the initiative of having, telling what you're asking of, has there been an increase of malaria because of the WASH initiative or reduction? And you're putting a point to it is probably maybe a few, I don't know, maybe Kathy will tell us in terms of percentage, but my being here and me being part of this is bringing the integration bit. The integration that we do not have to ride along just only the malaria bit. Very many things come up with, I mean, contribute to either reducing malaria or it increasing. And then WASH or sanitation and hygiene is one of those.
Okay, now the introduction of the malaria vaccine comes on the backdrop of already existing initiatives, and that poses another challenge, especially to the medics or the workers, health workers who administer the immunization, especially in the communities, where a child who has been on another set of immunization for preventable diseases, again has to get introduced to malaria. It can be a confusing one to the lay person, especially that one who hasn't even been following the schedule for immunization of the other diseases, especially as I can see here, we have tuberculosis, that's the BCG vaccine, poliomyelitis, I hope I got that right, or OPV, diphtheria, whooping cough, and then all of a sudden they are told, we now have another vaccine for malaria. They've not been meeting the other schedule. How do you cope with that?
Yeah. That's it's an excellent question, and it's indeed a dilemma. And I'll just pick it from a practical example. I think about a month ago, I walked into a clinic with my 10-year-old, and she saw, this clinic is on Gayaza Road, and she saw the vaccine schedule as you have it on that paper. And she asked me, Mommy, do children get all these vaccines? She read them, and I told her, yes, they do. Then she said, how do the parents keep up? And I told her that they have a card. So it's indeed a challenge, but it's a journey. A journey of one step starts with 1,000 miles. Now we need to keep this information out there for the parents, out there for the health workers. So when we were rolling out the malaria vaccine, we did have training. We had, we developed a whole training plan at the national level with contribution from health workers and different specialists. The training was conducted not far from here, just at Imperial, and then we take this now down to every district. We have a team, a multifaceted team. You'll have a doctor, you'll have someone in M&E, you'll have a communicator like Marion, you'll have someone who is strong in operations and systems, and then you go and you train the different districts, working with the district health officers, the district health management teams, and then you go down up to the facility level. So that is one way, and you allow them to interact with it, to ask questions. You also give fact sheets. But that also requires tools to have been revised. So these things are on the walls in the health facility. The different vaccine leaflets that you've seen are around the country. But importantly, you also need to educate the public. And my strong belief is that every mother, every father desires their child to have the best.
No doubt.
And Uganda has a strength in that when I look back into the curriculum, I'm a parent, and I look at the books once in a while, and you see that they introduce, even when you remember our times, Chris, we knew that there were 6 killer diseases. Yeah. So as a child, you start growing knowing there are 6 killer diseases. There's polio, there's whooping cough. I remember those pictures with the child vomiting. So we keep that going in terms of the education sector doing their role, training even that little child of mine who is 10 and she saw them. That is one way. So by the time that girl is growing, she's grown to 20, 24, she already knows that a baby should be vaccinated. And then at the health facility, the information, the training, and then what we are doing, we're also contributing to that.
Sure. Yeah. Because rolling out information by way of engaging media houses of the fourth estates is pretty much a very strong avenue through which that particular objective can be achieved. Now, when it comes to prevention methods already existing, and then there is the vaccine. There are some of us who will assume that since the vaccine has been administered, the other prevention measures are null and void. Advise us on that.
Not true, not true, not true. So malaria is a complex interplay between the host. We have a triangle we draw, and I think I should have been a teacher, but I got locked up in medicine.
You are.
So there is a host, there is a vector, and then there is the parasite.
Yeah.
Okay.
So to win the game, you need to tackle all. So the host is where the vaccine is acting. You're introducing the vaccine, it's getting into your body, it's helping you develop antibodies, so that when the parasite does come in, your body knows that this is an invader and this is how I fight. I mobilize X to fight this parasite. So the vaccine acts at that level. Now, there's the level of the vector, which I talked about earlier. Those tools, the bed net, now kills the mosquito. The removing stagnant water makes sure the mosquito is not breeding. The spraying kills the mosquito. So you must work on the vector as well. Then there is the parasite on this side. Medicines work on the parasite. That's why we must treat everybody who is sick. Because if that person is not treated, then the vector is able to pick the parasite and take the parasite to the host. So you can't just work on one arm.
Okay.
Everything, actually, most things in the world, you can't work just on one arm and say you'll do this one thing and you're good. Even in education, they say they train the hand, they train the heart, and they train the head. So the vaccine is just the host.
Okay. Now, can vaccines be administered on a single day? Since we have a litany of them, my singer, or let me say my cousin, could want to go to the nearest health center in Kachonga, in Butaleja, and she faces the dilemma that her child hasn't received BCG, hasn't received OPV, hasn't received DPT, that's Hep B and HIV, and all of them are required to be administered. Can that happen in a single day?
We have
because even to me, who is here at NTV, that is scary.
You're scared.
Yeah, it would be.
The good thing is babies are not as scared as parents. They're not as scared as mothers, and definitely not as scared as fathers. Fathers are perhaps the most scared. So the vaccine schedule has been carefully planned and studied to understand which vaccines can be given when and with what. But also, if you miss one, which we wouldn't want, there is also a catch-up plan. So if the mother takes the little one, or let me say the father takes the little one to the health facility, the health worker is able to advise that at this point in time, we can give you vaccine A, B, C, or D. And there are some dates like 6 weeks, 10 weeks, and 16 weeks. Those ones have many vaccines. You'll find a child will get about 3 or 4. But that should not be a worry. And they're usually different sites. You find it's the left thigh, the right thigh, the upper arm, and the mouth. The body is able to cope with that and develop the required responses.
Okay.
So the health workers are trained to advise the mother, when can you come back? If there's one that can't be administered, then they still give them a date and mark it carefully.
All right, Marion, there are concerns about a certain health workers and health facilities that appear to charge for vaccines. What we do know is that vaccination is free, but some medics and health workers behave like this vaccine is supposed to be paid for. And the unsuspecting Ugandan out there, or the uninformed Ugandan, might actually pay firsthand, because after all, I want my baby to be safe, without necessarily appearing to the medic that I'm overly conservative when it comes to the life of my baby. Help us demystify and debunk that. Let people know how much a vaccine costs and whether we should pay or even get an FRIS receipt.
But you see, Chris, the list that you have there on the table that you have, everything there is free.
Okay.
And it is administered, or they are administered in government facilities. The national referrals, regional referrals, until the lowest health facility that carries out the vaccine. I mean, that immunizes.
The immunization,
So the ones who are paying for a free vaccine in a government hospital, I think that is, like my boss would say, subject treason.
Yeah.
You know, those are things that Dr. Diana says, that is treason, because you're literally denying someone of a service that is free, and you're charging them, and if they can't afford, the person literally walks away. Now what happens? The child gets it, falls sick, or probably gets a disease or disabled or something. Yeah, so I think one of the things that we have emphasized is the public, or mother or parent or guardian or caretaker takes the child to a government facility where they are going to find a free vaccines that are administered. Those that want the quick fix, that want don't want to line up. I know I know sometimes the frustrations
so
are the line.
people are actually paying for the support services to immunization, not necessarily immunization.
No.
I don't want to be in the line.
No.
I want to be handled in a good way.
And probably they tip a health worker or something.
Okay.
Yeah, like that. But the truth is, and I think even if it happens, you know, somehow, you know, most people nowadays have learned to be each other's keepers, especially in our government hospitals. And when they see a health worker being, getting money from someone, a parent who has come in, and because they want to jump the line, or because they want whatever, somehow we get to know. We get to know. And we probably address it with administration right down to the health worker that did it. But of course, like any other facility, you have to go early. If you want to get the vaccine, you have to line up, but you will get it. You will not fail to find it. It's just that you know the people that always want to access the quick fix and maybe do the government, the private, and are always people like Chris who are in NTV and the banks, and they have to go to the other private health facilities. But of course, for us as Ministry of Health, we preach the gospel of, like, the vaccines are available, the vaccines are free, and you can find them in any of our government facilities. Okay. Yeah.
Now, Doctor, there are a lot of, not a lot, the word is an exaggeration, but I see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. That's more than a dozen vaccines, including those that are being introduced. It's more like going back to something that we should have addressed a little bit earlier. The introduction of, for example, the yellow fever vaccine.
Okay.
I've known the need to have a yellow fever vaccine for as long as I've gotten in touch with medical facilities. But there is still a lot of ignorance regarding the yellow fever vaccine. Come on, relieve us of our ignorance.
Relieve your ignorance. There's a time I attended a school meeting. I'll not say which school.
Please.
And we were at the crossroad of that time when we had a vaccine campaign. And why did the government up its game in terms of yellow fever vaccine? So yellow fever vaccines have been here for many years, tons and tons of years, and you can't cross the border without a yellow fever vaccine.
Actually, people never realize the importance until they're invited for a big event.
You can't get out of this country, and you can't enter several countries without the yellow fever vaccine. So it was really being taken up by people like that who are traveling, and that's just a small proportion. And we started getting outbreaks. Now, when you have an outbreak, because the way a vaccine works is the more people that are covered in a population, the better, the stronger the immunity. If she's not contracting a disease, then I'm not going to get it, because where am I going to get it? She's safe. Everybody is safe in the room. We are safe as a whole. But now with that very small coverage, we started getting outbreaks. And the outbreaks usually will start in the border places, because borders are porous. And the government said, no, we need to protect our people. And that's when we had the yellow fever campaign. And people start wondering, why are they giving us the yellow fever? Why now? Why not? And of course, it also suffered from the backdrop of COVID, because this campaign is in the post-COVID area. We've really suffered from COVID, and we'll continue suffering for a long time. But I remember what helped me in that meeting is I asked the parents, how many of you have ever received a yellow fever vaccine? And almost all the hands went up. Then I asked them, how many of you can travel out of this country without a yellow fever? And the hands all went down. Then I asked them, how many of you have had side effects from yellow fever vaccine, only one hand stayed up. And these were over 1,500 parents. And then I asked, how many didn't recover from the side effects? No hand. Then I asked them, how many of you have ever given another child the yellow fever vaccine?
You're confused then.
So many hands went up. No, they were following. These were elite parents like yourself. So ultimately, they realized that the noise on the vaccine was not even because they didn't want the vaccine. They were just making noise. So what am I saying? The vaccine is safe. Vaccines are studied rigorously before they are brought into the country.
Yeah.
That's right.
There are studies, there are clinical trials. We have level 1, level 2, level 3, up to level 4. And these are rigorous research trials. They are done by people who are not, they have no conflict. They have good intention and goodwill. And even once they've done their studies, the results are collated. They pull together the results from several countries, several trials, and these are analyzed by governing bodies. There are bodies at WHO, there are bodies at Food and Drug Authority, and even here in the country, in Uganda, when the vaccine arrives, our NDA looks at it, studies it, and it's constituted. We also have other bodies within the country that look at these vaccines, and they are constituted by elite people who are well-intentioned. So I told them that the government brings things not to harm us, dear parents. The government brings these vaccines and other initiatives to protect. And we got good vaccine coverage. So by and large, at times we don't engage the communities enough. You bring something and you're using a top-down approach. You're just bringing it, you're not explaining. But when you sit and engage with people and they understand, they take it up. But of course, we still have yellow fever because it's also transmitted by a mosquito, which goes back to hygiene, to removing stagnant water, bushes, using the net. So malaria, if you're preventing malaria, you're also preventing yellow fever.
In a way. Marion, when it comes to challenges regarding uptake and reception of this information, I think there is a lot more that needs to be done. If you don't mind, share with us some of the innovative methods that the ministry is taking on. Today, we have a challenge on people who have very little attention time spans, especially when it comes to information that is deemed boring on social media and all these platforms. How are you making this information, I don't know how to describe this,
savvy,
hip, entertaining, you know,
vibe,
enriching them. You must be innovating in order to attend to that particular demographic.
Yes, Chris. First of all, I will start with the elite, which is happening right now. But I don't know how many people we're speaking to right now, but I think we're speaking, and I know this is live, so I know the people who can access right now their devices and can go online and Twitter and X are listening to this. But what we have done as a ministry, we have beefed up and worked with every entity, right from the local structures, in terms of the last person to give information is the village health team member. And now we have the community health extension workers. And then who are at parish level. The other one is at village level. We have at parish level. And then now we have the district health education officer, who is now at the district level. Then when now we go to local government, that's when now we involve all these, the cows, the RDC and all. But what we've done at the community level, we have what we call the barazas. In English, we call it the community dialogues or whatever. But you know, a baraza is sitting on a veranda and just having a discussion and a conversation. So we have community barazas. And these are actually ongoing up to now. Now, in these barazas, you do not know, we have a collection of all the different people I've mentioned. We shall probably have a health worker, we'll have a community leader, we'll have a clergy, we'll have a cultural leader, all that. But we realize that even the baraza, sometimes you're speaking to many. Now, how about breaking it down? So now what we did, we also went and started working with the kingdoms. And the kingdoms, you know, all kingdoms have health ministers or have health. They call them ministers or health, I don't know, categories or whatever. Abakungu, something like that. So now the health ministers have helped us work with the cultural leaders. Let me say, for example, like the category of Uganda, oh my God, he is so if you listen to him talk about malaria vaccine, you can think he's the one who invented it. Because he has embraced, he has embraced to study and understand it so well that you'll think, and when I went to talk to him, when we actually had a one-on-one an interview, I remember I went with one of Walter, one of your staff, and we're trying to do an integration of WASH and bring in other diseases. But he started with WASH, eventually he got into science. Then I asked him, but Mr. Katikiro, are you a doctor or a lawyer? And he's like, Marion, you know, for me who talks to masses every day and I have a communication to make, I have to make sure I deliver this. Now, what did we do with especially the cultural leaders and church and that the church or the Christian or the Anglican or the whatever faiths? We worked with the leaders to have what we call pastoral letters. I'm saying a pastoral letter because maybe it can come. You know, a pastoral letter, but I wouldn't say, I don't want to say pastoral and think maybe I'm talking about a pastor. No, I'm talking about a letter that has a summarized communication of one pager that every time the what's it called, the bishop, the pastor, the sheikh, all the people are going to the congregation. As they're doing the announcements, the first thing they'll say, we have a vaccine. We have this. We have this. So we've also packaged that for them. Okay. But also there's continued, like I talk right now, one of our colleagues is in Lango and meeting all the cultural leaders of Lango. We have another team that is going to the east, another team that is going to the west, another team that is in the central. So the communication team is all over and we are not stopping. We are going to continue and continue. Now come back now. We have worked with these two gentlemen, I always forget their names, these comedians, one who's, what are they called? Okay, the comedians. Yeah. Who
Rain and Maulana?
The two who work with the comedy, the factory comedian or whatever. I haven't
gone for a comedy show in a long time.
Then you need to. Interestingly, whenever, I always go for I always go to Thursdays at National Theatre. I don't know. They have also mastered, they will throw in something about malaria. Yeah. But they will throw it in a way of acting and saying, you look like you're sick and say, yet it's just a what? A line into their discussion. Right. So we've worked also with those people to bring in the messages. So we have worked with the comedians, we've worked with the musicians, we've worked with the influencers. You've seen these guys who walk on the street and say, what do you think about the vaccine? Random interview.
Folk sports, yeah.
We worked with teacher Mpamizo. Teacher Mpamizo, the one who mimics the president. That one has been our go-to person. And then Ministry of Health as a whole, we have influencers. About 10 to 17 influencers. The ones who are always given information and they're 24/7 on internet, I mean online, on X and Instagram, Facebook, everything, and they're
TikTok.
posting. And by the way, Ministry of Health has a very active TikTok account. Really? Oh my God, you need to visit it. Wow. You'll see what we are doing. We are acting, we are dancing about every kind of disease, but particularly this very vaccine. So we have explored.
That is very complimentary to your efforts, Doctor, and I'm sure it's a plus for Marion and the team in conducting that particular work. Now, let me transition to tetanus and diphtheria. I see women of childbearing age should be vaccinated 5 times to protect themselves and their future babies against tetanus and diphtheria. Talk to them.
I wonder whether I should talk to them first or talk to the health workers. It's a bit, it's dicey. But when you talk about 5 times, you take me back to my school days. And we used to get that injection at school. And these are some of the fora that we have lost. And I don't know whether many schools are giving DPT. Once you turn 15 or even just before, they'll give you, there was a schedule, it was well known, with a small pink book, and you'd get your injection at least every year. You were entitled to an injection. And definitely you'd know school enrollment at that age also is low, so there's also some work that's needed at the community level to find those women or girls aged 15 to 49. So what is the danger with tetanus? Tetanus, first of all, it causes a lot of disability when someone does get it, and we've even seen deaths coming from tetanus. The organism is in the soil, it's on contaminated surfaces, and when you're cut, it gets access to the body, and then it will cause the damage. And yet just a few injections would prevent it. So for women, for girls, for teachers, for health workers who are handling anyone 15 to 49, and not only girls, even the boy child should receive a tetanus injection. It's important that they get this injection. They shouldn't miss it even at antenatal care. And it's up to also the lady, the mother, the woman, to ask that, why haven't I been given? Can I receive a tetanus injection? And you get it within antenatal care, and these are free of charge. The other challenge we have is, of course, once the lady gets the TT shot, that means that the baby, when she's expecting, the baby is protected. Now, you know, there are so many myths and misconceptions in the community. As soon as the baby is born, so many people can come to visit. This one wants to put this on the umbilical cord. This one wants to put that on the umbilicus. And that's another avenue. People put all sorts of things, including cow dung, on the cord. And you can see direct inoculation. And we do lose those babies from all sorts of things. So my message would be every girl aged 15 and above should ideally be approached through the different avenues. It can be community, it can be school, it can be facility. But for ladies in that age, expecting women, they should request for the jab.
There are questions within certain segments of society, and of course this is down to misconceptions and myths around vaccination. Fertility. Is there any effect whatsoever a vaccine can occasion on a woman's fertility?
None that has been studied and documented scientifically.
Great.
Yeah.
Let's not add anything on that.
But you heard about the misconceptions about that we
those ones are really
addressed during COVID. That there's going to be a coin. There's going to be a coin developed around your...
that was a bit myopic for some elements to even accommodate
exactly, yeah.
And
so
I'm glad
and there will always be those what are they called?
Anti-vaxxers.
Anti-vaxxers who will always come. You
now,
know that.
Now that you brought that up, you're a communications expert. How are you dealing with these ones? Because they have what appears to be a very strong lobby, and they have their objectives, and they are also using the same platforms that you are using to distribute their information. And when it reaches that level, it's a point of who is giving more information than the other that might win the battle. You shouldn't allow to lose on account of releasing less information. Yeah.
No, I think what we've done, and I think it came up during COVID, and of course at the introduction, I think, of the malaria vaccine, we had them. And what we have done as Ministry of Health, of course we have our PR, you know, our PRO, senior PRO, Emma, who deals directly most times with these anti-vaccines. And what we find out most times when we're engaging them is to actually find out what's the motive. Because certain times it's just someone just wanting the attention, or sometimes they also want, sometimes they politicize, they want to politicize it and think that now, and they always bring it in an angle of saying we want to kill, want to reduce the population of the country.
White man is against the black man,
all those
and
things
is manipulating
and all.
The government.
But we have engaged one-on-one to find out, how do we help you? What is the message that you want us to put out? Or through you, what do you think we can work on? Maybe the way the vaccine introduction came out was wrong in a way that you captured the other bit. You get, that was wrong. So how do we get your message and put it with ours to make sure that we are communicating the right thing? And I've noticed that when you have a one-on-one with them, and sometimes these guys come out because they also want to meet the minister, they want to meet the PS, and we say, okay, she's available. Do you want to have a chat with her? And they have a chat. And after they had a chat, then they say, so can you take this message and actually communicate the right thing? Because I think what you brought out was not right, and you're going to mislead. So what has worked for us is actually getting them to find out what exactly is the issue. Is it the way we lay the information out? Are we given the right information, the wrong information? Do you want to be one of our ambassadors? And as long as you give them the platform to be an ambassador for us, we both won the war.
And some come on.
Of course.
Doctor,
Yes, sir.
I know in building defenses against diseases, it's a multifaceted issue. It's like an army. You need the weapons. You need the guys to eat the food so that they can be strong. But you also need them to wear clothes that fit the war. Nutrition pretty much provides what I believe is very critical on the workings of these other interventions. But the question is, should nutrition be achieved before the vaccination, after? Because some people might begin to care about nutrition after the vaccination. Others are good enough already, and they think vaccination, even before a vaccine comes in or not, is pretty good for them. Just advise on exactly how it should be.
Nutrition should be achieved before conception. Because life starts at conception.
Yeah.
So as soon and even before, everybody should be
Eating well.
Yes, eating well. You need a balanced diet. The bodybuilding foods, if I go back to what we were taught in primary, the bodybuilding foods, the energy-giving foods, and the health-giving foods. And if someone has not been having that, as soon as someone knows that they are with child, they should make sure that they have the three. They have the vegetables, they have the fruits, they have the carbohydrates, they have the proteins, they are taking enough fluid. Because what happens when your nutrients are not balanced, then the body is not going to mount a good immune response to any of the vaccines you're given. And if you and the immunity comes based on the response you've mounted, the antibodies you've been able to make so there's a way we can do antibody titers, and if you do titers is like measuring. If you measure the response for different people who are malnourished will not develop a good level of antibodies required to fight off the malaria. But also, if you're malnourished, when the parasite comes, it's going to ravage your body. And we found, you took us to that question earlier on. You asked about WASH and would you attribute the improvement in WASH in the different regions to the burden of malaria. And she actually said to the burden of disease. So if you're saying water, hygiene, sanitation, and nutrition, when you do like the demographic health survey, you find that places where there is poor nutrition, where those water hygiene indicators are poor, there is more disease. There is more disease. So Ugandans out there, people listening, it's important that in our homes, we have a balanced diet. Make sure that the food is well colored. And you've touched something important. We shouldn't live without talking about non-communicable diseases. Obesity is chasing us, and it's chasing us real fast. It's chasing our little ones. It's chasing our children.
It's quite disturbing.
And it's disturbing, and we're not bothered. I saw something on WhatsApp recently, and it was a food pyramid. And they had drawn a base, and the base had everything we shouldn't eat. And everything we shouldn't eat was tasty. It was the cooking oil, it was the biscuits, it was all these different concentrate drinks that we find, it was the sodas, it was a lot of sugar on the base. And on top there, the bananas and all were up there, and we don't eat those things. If you see our children, you put a banana on the table with an apple, and they're going to go and pick some nice juicy chicken that's all full of oil. So it's not just about eat everything, but we need to come to a place where we recognize that there are some things we don't need. We need to reduce on the sugar in our diets.
Now, that challenge particularly falls on the communications teams, not only in the Ministry of Health, but across all government departments. How do schools. How do you deconstruct the narratives around test, especially among the young children? Because believe me, many young children, if you have not done something like buying her or him tasty ice cream, somehow, somewhere, she's gonna know you're not a good dad, you know? And that plays out in the minds of these little ones to begin to attach good to the tasty things. And then if you, for example, left a directive at home that today we're going to eat sukuma wiki, mine have a tendency of say, that one, kawa, you know, sour. That is how they regard it. And so anything sour, despite the fact that we know the nutritious value, is seen among the minors as undesirable. How and what exactly are you doing to counter that deeply, rather loop-sided narrative within society? I know it has a business interest to it.
Yeah. I think one of the things that we've done is that we can't work alone. I think we preach the health bit of being healthy, but I think our other partner or line ministries have to come on board. And the two that I think have really come on board to help is more of the education, and of course you won't leave out the gender ministry. Yeah, because it all encompasses around. And I think the Ministry of Education has embraced working with us, especially when it looks at the communication guidelines in terms of nutrition, maybe wash, treatment, well-being. And now the curriculum, of course our curriculum, you know, it keeps changing all the time. Anything that comes up, we miss and it's in. But there's one thing to have a well-packaged document, and then there's another thing for someone to, the uptake. The uptake is also different. So
we hope for the best.
What the communications team has done in ministry with these other line ministries is to work with the structures of the school. Me and you, Chris, know that in school we had clubs, I think, which are still there. HIV club, nutritional club, debate club, whatever club. Now we're also having what we call well-being clubs, or something, I think it's called wellness club or something. Yeah, wellness club. Now in those wellness clubs, we only provide information, and now, of course, the ministry has now come up with an integrated communication document that does not have, that has each and everything. Yes. So which helps when those clubs are on board and they're having their debates and everything, all those things come up.
Well, those are all interventions geared at assuring that the very best possible information is out there for the citizens. Thank you very much, Marian Natukunda, Senior Communications Officer at the Ministry of Health. And
champion for WASH.
Champion for WASH. And thank you to Dr. Catherine Maiteki Sebuguzi, Deputy Program Manager at the National Malaria Elimination Division in the Ministry of Health. And thank you too for keeping it with us for this hour where we have been talking malaria, immunization, WASH, nutrition. But the take home is be focused as a parent. If you're a father, if you're a mother, begin to do the right things now so that you can save yourself and your young ones a lot of troubles when they grow later in life. It's been a pleasure having your company. I hope the communication is clear and you'll also take heed and ensure that you take the young ones for immunization. Not only that, stick to the schedule. And that's the message from the Ministry of Health and indeed the government. I'm Chris Higenyi. Have yourselves a good day.